High blood pressure, also known as hypertension, is a common health condition that affects millions of people worldwide. It's often referred to as a silent killer because it can lead to serious health complications such as heart disease, stroke, and kidney damage if left untreated. While medication and lifestyle changes can help manage hypertension, one crucial aspect of controlling blood pressure is through dietary choices. Experts recommend avoiding certain foods that can exacerbate high blood pressure. In this article, we'll explore 20 foods to avoid if you have high blood pressure, based on expert advice. Pickles and fermented foods. Pickles and fermented foods have long been celebrated for their tangy taste and purported health benefits, particularly for gut health due to their probiotic content. However, for individuals with high blood pressure, these foods may present a hidden risk. High sodium content. One of the primary concerns with pickles and fermented foods is their high sodium content. The pickling process involves soaking vegetables in a brine solution, typically consisting of water and salt. This results in a product rich in sodium, which can contribute to elevated blood pressure levels when consumed in excess. Sodium and blood pressure. Sodium plays a critical role in regulating fluid balance within the body. However, excessive sodium intake can lead to water retention and increased blood volume, putting added strain on the heart and blood vessels. For individuals with hypertension, this can further elevate blood pressure and increase the risk of cardiovascular complications. Impact on hypertension management. While occasional consumption of pickles and fermented foods may not significantly impact blood pressure levels in individuals with well-controlled hypertension, those struggling to manage their condition should be cautious. Even small servings of pickles can contain a significant amount of sodium, potentially undermining efforts to control blood pressure through diet and lifestyle modifications. Alternative options. Fortunately, there are alternative options for individuals looking to support their gut health without exacerbating their high blood pressure. Fermented foods such as sauerkraut, kimchi, and kombucha come in low-sodium varieties or can be prepared at home with reduced salt content. Additionally, incorporating probiotic-rich foods like yogurt, kefir, and miso into the diet can provide similar benefits without the sodium overload. Reading labels and portion control. For those who enjoy pickles and fermented foods, it's essential to read labels carefully and be mindful of portion sizes. Opting for low-sodium or reduced salt varieties when available can help minimize the impact on blood pressure. Additionally, limiting portion sizes and consuming these foods in moderation can mitigate their sodium content's adverse effects. Consultation with healthcare professionals. Individuals with hypertension should consult with their healthcare providers or registered dietitians to determine the appropriate dietary approach for managing their condition. A personalized nutrition plan tailored to individual health needs and preferences can help optimize blood pressure control while still allowing for a varied and enjoyable diet. Salt and high sodium foods. Excessive salt intake can increase blood pressure levels. Processed foods, canned soups, fast food, and salty snacks are often high in sodium and should be limited or avoided. Processed meats. Processed meats like bacon, sausage, and deli meats are typically high in sodium and unhealthy fats, contributing to high blood pressure and heart disease risk. Canned foods. Canned foods, including vegetables, soups, and sauces, are often laden with sodium to preserve freshness. Opt for fresh or frozen alternatives without added salt. Cured foods. Foods like cured ham, smoked salmon, and other cured meats contain significant amounts of sodium and should be consumed sparingly by individuals with hypertension. Sugary beverages. High-sugar beverages like soda, fruit juices, and sweetened teas can contribute to weight gain and high blood pressure. Opt for water, herbal tea, or unsweetened alternatives. Alcohol. Excessive alcohol consumption can raise blood pressure levels. Limit alcohol intake to moderate levels or avoid it altogether, as per medical recommendations. Caffeine. While moderate caffeine consumption may not significantly affect blood pressure, excessive intake from coffee, energy drinks, or certain teas can lead to temporary spikes in blood pressure. Trans fats. Trans fats found in fried foods, baked goods, and processed snacks can increase bad cholesterol levels and contribute to hypertension and heart disease. Full-fat dairy. Full-fat dairy products like whole milk, cheese, and cream are high in saturated fats, which can raise cholesterol levels and blood pressure. Opt for low-fat or skim alternatives. Red meat. Consumption of red meat, especially fatty cuts, can contribute to high blood pressure and cardiovascular disease. Choose lean cuts of meat and incorporate plant-based protein sources more often. Fast food. Fast food items like burgers, fries, and fried chicken tend to be high in sodium, unhealthy fats, and calories, making them detrimental to blood pressure control and overall health. Frozen meals. Pre-packaged frozen meals often contain high levels of sodium and unhealthy additives. Opt for homemade meals or carefully read labels to choose lower sodium options. Condiments. Condiments such as ketchup, soy sauce, and salad dressings can contain hidden sodium and sugar. Choose low-sodium varieties or use sparingly. Commercial baked goods. Commercially baked goods like cakes, pastries, and cookies are often loaded with sugar, unhealthy fats, and refined carbohydrates, all of which can contribute to hypertension and weight gain. Instant noodles. Instant noodles are convenient but typically high in sodium and unhealthy fats. Consider healthier alternatives like homemade soups or whole grain pasta dishes. Sauces and gravies. Many sauces and gravies, especially those prepared from mixers or in restaurants, contain excessive amounts of sodium. Opt for homemade versions using fresh ingredients. Canned soups. Canned soups may seem like a quick meal option, but they often contain alarming levels of sodium. Choose low-sodium varieties or make homemade soups using fresh ingredients. High-sugar snacks. Snacks like candy, chocolate bars, and sweetened cereals can lead to weight gain and elevated blood pressure levels due to their high sugar content. Opt for healthier snack options like nuts, fruits, or yogurt. Excessive salty snacks. Snacks such as potato chips, pretzels, and salted nuts are high in sodium and can cause water retention, leading to elevated blood pressure levels. Choose unsalted or lightly salted varieties or consume in moderation. Maintaining a healthy diet plays a crucial role in managing high blood pressure. By avoiding or limiting the consumption of foods high in sodium, sugar, unhealthy fats, and processed ingredients, individuals with hypertension can better control their condition and reduce the risk of related health complications. Consulting with a healthcare professional or registered dietitian for personalized dietary recommendations is advisable for optimal blood pressure management.